Hello, and welcome to Assist to Succeed Dental Assisting Schools. My name is Kindra. I'm the director and owner of the programs. I made this video because many times students or potential students ask us what the requirements to get into the program are. Well, first and foremost, we have to have proof that you have a high school diploma or equivalency. So, what we would need is for you to either text over a picture or email to us a copy of your high school diploma, GED, or even your transcripts. We don't have to have all of those, just one will suffice, but that would be the first thing. Now, we do have a lot of high school seniors that contact us they're seniors, so they're within their last year of school, and we can allow them to go through the program as well. I understand you won't have a high school diploma, so what we do is we ask you to get a letter written from your guidance counselor or your high school principal that will tell us you're on track to graduate, and then we can let you in the program as well. The next thing we need is we have to have proof that you have had your 3 hepatitis B vaccinations. Now, these are typically given to you when you're younger, sometimes even when you're first born. So you would need to get a copy of your shot record, but in the incident that maybe you can't find that record, those are completely safe to have done again. You can start those over again. What I do want you to know is it can get kind of tricky. When you get that first hepatitis B vaccination, you have to wait 1 month before you can get your second one. So if you're thinking of joining the program, now is a perfect time to start those series of vaccinations if you can't find your shot record. The big trick to it is you cannot get the 3rd vaccination until 6 months after you're given the first one, which obviously you won't be in the school or the program anymore. You'll have graduated. We have to have proof that you've at least had the first 2 vaccinations and that you're scheduled for the 3rd one before we can issue you your radiology certification. This comes from the Ohio State Dental Board, this radiology certification, and you cannot practice dental assisting without it. So as long as you have proof that you have been given the first 2 vaccinations and you get proof of when the 3rd one is scheduled to be given to you, the board will accept that for you and they'll go ahead and give you your radiology certification, which is a sigh of relief. So as long as you have started the series by the time you start school, you'll have proof of that 3rd one so that we can keep you on track and you'll be great. We also need you to get a tuberculosis skin test. Now, this is a test that you'll go in and they give you a little prick of medication under your skin, and you have to go back 2 days later to have that site looked at to see if there's a reaction. So just so you know, for scheduling purposes, if you don't already have that tuberculosis skin test, you'll want to make sure that you get it scheduled on a date where you can go back at least 1 to 2 days later to have that injection site looked at. Now, hepatitis B vaccinations, there is a tuberculosis skin test. There is a 1-step tuberculosis skin test, and there's also a 2-step. You only need the 1-step. It's a lot easier and less expensive. So just a 1-step tuberculosis skin test. You go in, you get the medication under your tissue. You'll go back at least 1 to 2 days later to have that looked at for scheduling purposes. And then last but not least, as with any school, we would need some kind of financial obligation to allow you into the program and reserve your spot. We do fill up pretty quick, but if I know you're extremely interested, I'm more than happy to reserve you a spot while you try to make those accommodations. So we have to have some kind of a down payment made in order to reserve that spot. But again, as long as we're not filling up too quick, I'm glad to reserve a spot for you while you figure out that obligation. So there's so many different ways to get into our program. There's governmental grants. We have payment plans, payment options of biweekly payments. We have wonderful loan financial partners that can give loans out to the students as well. So depending on what route you take, will depend on how we kind of customize that plan for you and how we try to help you afford the school. But we always say, don't be afraid to ask questions. You know, the worst thing we can do when it comes down to a payment plan is say, no, we can't accommodate that. So we try to accommodate everyone's. Just keep in mind, the program's only a 10-week program, and there is a certain amount of money that we have to have collected from you by the time the program's over in order to meet our overhead and make sure we're not going under with the amount of money we collect. So, hopefully that helps you with what the requirements are. Again, we would just need proof of high school graduation or GED. For high school seniors, just proof that you're on track to graduate. We do need proof of 3 hepatitis B vaccinations. Or at least that the third one's scheduled and you have the first 2. We would need a tuberculosis skin test as well, and then some kind of a financial obligation. We are more than welcome and willing, like I said, to go out of our way to try to make this affordable for you. So if you have an idea or plan or something you think might work, just let us know. A lot of times we say yes because we want to help you get into life, get an education for a wonderful career. That way you don't just go to work at a job every day. The worst we can say is no and try to continue to help you find something to get into the program. So I hope that helps in regards to the requirements to get into Assist to Succeed. We would absolutely love to have you, and feel free to reach out to us. You can text us. You would be texting me personally. You can text me at 740-602-1250 with questions or concerns. And by all means, you can always email me as well. That's Kindra, Kindra, at assist, ASSIST, the number 4, dentist, DENTIST.com. I hope to hear from you soon. Thanks and take care. Bye.